Good evening, uh, Professor, and whoever else is watching. And my name is Jared Alexander. Here's to my name, today's date, and here's my notes, just a list of things that I need to identify as I go through this. So today, dissecting the sheep kidney. I'll throw on my masking goggles while I do this, and I will pause this video. Okay, so I'm back now. I sliced my kidney in half with I have one side here, and then that does not have the ureter, afferent, efferent arteries. The kidney vein and arteries supplying the vein drainage. That's on this side with the ureter as well. So I'd like to start with this side. On the outside would be the fibrous sheath that the capsule, the renal capsule that goes over this here kidney. I'm going to use this to point. So right here is the hilum. This is where the as seen with this kidney here, there's the hilum, and that's where the ureter meets with the renal pelvis. Is this large area right here right at the hilum, and up here are the kidney sinuses, the renal sinus, my apologies. And so right here, the lighter color on the outside, as we go in from the outside of the capsule, where that would be the renal cortex, which is the outside, and then we have the medullary, renal medulla, and then there are some pyramids here, as you can see, and the minor calyx, about 4 to 5 of them join to make a major calyx, and those are right here, and they meet up to make the renal pelvis. So right here, it's hard for me to tell, but I have a renal artery and a vein. I'm kind of having a difficult time with the sheep kidney to know if this is the left or the right kidney, but and I don't want to assume. But I do have the pyramids, went over that, the renal columns. Columns are just like a subdivision. Each column has a portion of the renal cortex, the medullary, the pyramid as well, and a pyramid, renal pyramid. Went over the renal pelvis. This is the superior portion up here of the ureter, and this is the more distal portion. And make sure I'm hitting all my wickets here. And then, so for clinical application, I'd like its identification of location for renal calyxes. I'm sorry, calculi. So it's important to know because how the nerves. Somebody has a kidney stone, so to speak, they tend to mimic also such thing as like ovarian cysts and appendicitis, and also it's good to know like if someone's having a kidney stone, where they could possibly pass in it to help differentiate, make differential diagnosis. So if there's a kidney stone while it's still in the nephrons, working its way out into the papillary, or papillae, that's nephrolithiasis. Or sorry, nephrolithiasis. And then once you get it in the ureter, urolithiasis. Lithiasis, and if it travels down the ureter into the kidney, or I'm sorry, into the bladder, then we have the cystolithiasis, and so where the kidney stone is located will exhibit certain signs and symptoms on a physical exam. The ones that are more primarily proximal to the kidney tend to mimic a lot of the location for like an appendicitis if they were having a right kidney stone. So it's good to know the identification, location, anatomy of the kidney structures to help formulate those diagnoses and treatment for those common kidney disorders. So I just want to cover everything I went over on my notes here. So I've got the renal cortex, renal medullary, the renal pyramids right here, the renal columns, again, extend from the cortex to the pyramid, and then the renal sinus, and then which are the little hollow spot like right there, And then renal hilum, which is this indention where the ureter, renal pelvis, and the vein and renal artery and vein enter and exit. We have the minor calyxes, which conjoin to make the major calyxes. Already went over the renal pelvis and the superior portion of the ureter. Thank you.